Joining us here today. I would like to begin on behalf of Premier Ford and our government by extending my appreciation to all staff, physicians, nurses, and volunteers here at Toronto General, and at all University Health Network sites for your dedication to providing exceptional care to Ontarians. You are all making a tremendous difference in the lives of Ontarians each and every day. And you are helping to build a stronger, collaborative, and more connected health system. As we continue to implement Ontario's plan to build, it's never been more important that our healthcare providers and frontline workers have the facilities they need to continue providing care for patients in a safe and comfortable environment. Investments in infrastructure projects help hospitals and community health providers make the necessary upgrades, repairs, and improvements to ensure they can continue delivering accessible and high-quality care for patients and families. So today, I am pleased to announce that our government is investing $182 million this year to support critical upgrades, repairs, and maintenance in 131 hospitals and 65 community health service providers across Ontario. This funding helps address three priority areas: health and safety, code compliance, and maintaining the integrity of our hospital facilities. Among other things, this funding will help our health system partners replace roofs and windows, upgrade heating, ventilation, and HVAC systems and backup generators, and meet the requirements under the Ontario Building and Fire Codes. As part of this funding, the University Health Network will receive $10 million to help address related issues across all of their sites. I know Kevin will share a few words afterwards about how this funding will help improve UHN sites for both patients and staff to further support the high-quality care provided by Ontario's hospitals. The government is providing an additional $827 million to hospitals across Ontario, representing a 4% increase from last year. This will ensure all publicly funded hospitals receive a minimum 2% increase to their budgets to help them better meet patient needs. We will continue to invest in patients, hospitals, and our frontline healthcare workers to ensure Ontarians continue to receive the care and services they need and deserve. In fact, Ontario's investments over the next 10 years will lead to $40 billion in health infrastructure improvements across the province. These investments will increase capacity in hospitals, build new healthcare facilities, and renew existing hospital and community health centers. Now, before I turn it back to Kevin, I want to speak to what is top of mind for many Ontarians. This year's cold, COVID-19, and flu season have been particularly challenging for our children, where we are seeing higher rates of RSV amongst those in their younger years. Today, I had the opportunity, or yesterday, my apologies, I had the opportunity to meet with the Children's Health Coalition, and I want to thank them for all the work they've been doing during this challenging time. We are continuing to work hand in hand with our pediatric partners to get through these challenging times. We anticipated a surge in our pediatric hospitals and took early steps to prepare. Ontario Health and our hospital partners developed surge plans, capacity plans, and we expanded bed capacity by 30%. We are building on these early efforts and continuing to work together. We have seen a level of collaboration among the entire healthcare system like never before. And for that, I want to thank Ontario Health and our hospital partners for coming together to protect our children this respiratory season. I also want to take this time to remind Ontarians that we need to get back to basics to protect ourselves and our loved ones as we spend more time indoors. Stay up to date with your vaccines. This includes your fall booster and your flu shot. I'm proud to say that tomorrow we are expected to reach another milestone of over 2 million fall booster doses administered. Screen for respiratory symptoms daily for yourself and your loved ones. Stay home if you're sick. Always practice good hand hygiene and wear a mask in indoor public settings. Our government is providing Ontarians with the tools they need to protect their families this cold and flu season. Thank you. Stay well. Merci. I'll now pass it back over to Kevin.
Thank you, Minister and Deputy Premier Jones. On behalf of University Health Network, and indeed all of my colleagues, I want to thank the Minister and the government for this needed investment in the Health Infrastructure Renewal Fund. As you can see, our activities have already begun, and clearly that will benefit patients and, most importantly, benefit the well-being of those we serve. We also have the opportunity to improve the work conditions for our staff, which more than ever before has been so very important. We're at University Health Network, these resources will allow us to invest in areas like improving our air quality, improving our receiving areas, improving our access and entrance, particularly for patients who need an accessible and available entrance and delivery system. So in closing, again, always a pleasure to welcome Minister Jones to our hospital, and thank you for this needed investment in hospital infrastructure on behalf of UHN and the system. I'll now turn things over to Hannah Jensen, who I believe will undertake the question and answer session.
All right, we will now begin to take questions from the media. If you want to step up to the scrum mic here, as a friendly reminder, it's one question, one follow-up.
Hi there, Alan Hale from Queen's Park today. I was hoping you could address a perception that is out there, especially online, that this government, that the actions of this government are intended to undermine the effectiveness of public health care, to open up the possibility of the government saying down the line, oh, again, the public system isn't working, we need to increase privatization. And this has sort of been boosted by your refusal to repeal Bill 124. You've been using weaselly sort of talking points about people being able to pay with OHIP cards and not credit cards instead of actually saying, no, we won't privatize anything. You're refusing to increase the budget, the healthcare spending in the new fall economic statement when we're having a pediatric healthcare crisis. I was wondering if you could please clearly and unambiguously give those people reassurance that the healthcare system will continue to be publicly funded, operated, and staffed no matter what happens.
Well, I would suggest that you only need to look at our most recent budget that was passed in August of this year, and that was a $5 billion increase in the healthcare budget in the province of Ontario. We are making the investments. We are working with our healthcare partners to ensure that everything they need, whether it is COVID related, whether it is for influenza, whether it is for RSV, or whether it's for generally operating and keeping our system healthy, we are making those investments. And we've done that through a $5 billion increase in one budget alone 4 months ago.
Minister, you're doing the same thing. You're not answering the question. Will there be
$5 billion?
No, but will there be any? Will the healthcare remain privately funded, operated, and staffed, regardless of what happens or in the future? Will you commit to that?
I will repeat again, a $5 billion investment in Ontario's publicly funded healthcare system sends a very clear message to our healthcare partners, our patients, our caregivers, that we are investing and we are supporting public health systems in the province of Ontario and continue to do so.
Hi, good morning, Minister. Colin DeMello from Global News. So we filed a Freedom of Information Act request. Sorry, I can't quite speak. It's cold. We filed an FOI request for your house binder, and we noticed that there was a line in your house binder that somebody had scribbled out. The line was, quote, "No, we are not privatizing healthcare, full stop." That line was scribbled out of your house binder. Can you explain who would have scratched that line out and why?
Listen, I'm going to answer that question the same way I answered that question in question period that day, and that was no, no, no. We are making investments in our publicly funded healthcare system in Ontario. We will continue to make those investments. We will ensure that people have services where they need it, when they want it in the province of Ontario.
And on the current crisis, you said a few moments ago that you had expected the surge and you had prepared for the surge. Can you give us a sense of what the government actually did to prepare for the surge? Because the surge is happening. There are children who might not necessarily be getting the care that they require as a result of the overwhelming number of patients in hospitals. So how can you say that your government expected and prepared for a surge when the surge is actually happening now?
So I want to give the people of Ontario reassurance that if your child is sick in the province of Ontario, you are going to get the health care you deserve and you need in a timely manner. When we anticipated a fall season that had the potential of having a higher influenza rate, a higher SVP rate, RSV rate, we put the plans in place. We worked with our hospital partners saying, where can you build bed capacity? Where can the surge be assisted? I will point very directly to CHEO in Ottawa, where they were able to change a ward area into pediatrics. It speaks to the innovation when we give the investments, when we work with our partners, that they are able to make sure they have the preparation in place. Are we challenged because of Health Human Resources, because of the need for additional healthcare staff? Absolutely we are. But the innovation that's happening, the cooperation that is happening between community hospitals, between specialty hospitals, and adult primary focused hospitals really is unprecedented. And I'm very proud of that cooperation. And I want to make sure that when those partnerships and relationships happen, we're there as a willing funder and partner as well.
Minister, good morning. It's Richard Southern with City News. You're announcing $180-some million today, which is a drop in the bucket compared to the $3.5 billion contingency fund your government has on the books. Is the healthcare crisis with pediatric ICUs overflowing not worthy of smashing open the piggy bank? My question to you is, where is the new money for hospital staff today, and why is there no new money for hospital staff, Minister?
So again, I will point to the most recent budget that was passed in August of this year, a $5 billion investment in Ontario hospital and healthcare systems. We're making those investments. We're ensuring that as the ideas and innovations come forward to us, that we have the appropriate funding and investments and giving our partners those opportunities to, frankly, do business a little different, but making sure that at the core, we are serving patients.
Okay, I didn't really get a response there, but I'm going to move on to my next question. We've done some stories recently on parents ready to bring their children suffering from RSV to Buffalo because they had troubles finding treatment here. My question, Minister, is how far afield from their homes are children being transferred right now?
So we have some examples in Ottawa in particular where there are a couple of patients that have moved to Kingston because they have capacity. So when we have an need in one community, one area, and we have an underutilization in another, collaboration and partnership is a good thing, and we are seeing that within our hospital systems. When there are opportunities for others to step up and help, we saw this during COVID-19 where sick kids nurses were moving into other hospital facilities that were challenged with COVID-19. Now we're seeing the reverse. When our pediatric hospitals need help, we have other community hospitals that are stepping up and supporting them.
Minister, what would you say to the parents that are just down the street at Sick Kids waiting 10 to 12 hours to be seen with their sick child when they say the government isn't moving fast enough to fix this crisis?
I will say to those parents that I completely understand your distress, your concern, but you have a government who has your back. You have a government who is supporting investments in our hospital system. You have a government that as recently as 4 months ago passed a budget that had an increase of $5 billion in the healthcare budget alone. We are making those investments. We will continue to make those investments, and I want to reassure the parents that when your children need healthcare in the province of Ontario, you're getting it and you will continue to get it.
Morning, Minister. Liam Casey with the Canadian Press. How many children are in ICU right now across the province, and why is that data not public?
So my understanding is the data is made public, but there is a bit of a lag because, frankly, it's a moving target. It goes up and down depending on how many are discharged, how many are moved to a community hospital, perhaps repatriated to their own hospital. So it's data that is constantly being changed and monitored.
Sorry, can you just give me a number? Like, what's the latest number you saw?
So I mentioned that pediatric ICU, we've actually increased capacity in the province of Ontario by 30%. So we've done that work. The ICU, my understanding is many of those patients are RSV related, but as I said, it is a number that continues to move back and forth depending on the day and depending on the hospital. That's exactly why we have the partnerships that I just spoke about, where when there is a larger need in one community, we have other hospitals who are stepping up and providing assistance.
Okay, I didn't hear a number there, but I'll go on to the next question. How bad do children's hospitals have to get before your government implements some sort of preventative measures to help out? I know you've spoken a lot about all the measures you're doing downstream, but what about upstream? What sort of preventative health measures, like mask mandate or things like that? What's the trigger point to implement some public health measures?
So I think it's really important to remember that many of the tools we have now, we didn't have at the beginning of the pandemic. We now have the ability to, we have sufficient, for example, COVID-19 vaccines to make sure that people get their booster shots. We have sufficient flu vaccines to make sure that people go and get that influenza flu vaccine. We're going to continue to provide and explain how important it is through the work that Dr. Kieran Moore is doing as our Chief Medical Officer of Health, to all of the hospital leaders who are constantly reminding and sharing what we can do as individuals to protect our family as we work masking, of course. We've talked about how there is great value if you are looking after a vulnerable individual, if you are in closed indoor spaces, to wear that mask. There are so many more measures that we have now that were not available to us 2+ years ago, and I think all of us need to understand and appreciate that we have the ability to actually drive the curve down and keep our youngest safe and protected.
Minister, you talked about parents should be reassured that their kids will get care if necessary. But what we're hearing from doctors and parents, you got long wait times. You have simple things like children's Tylenol, amoxicillin. There's a shortage. And as Richard just mentioned, a 3-year-old boy nearly went to Buffalo because he couldn't get care here in Ontario. The question is, at what point is this considered a crisis, or at what point do we consider this system just broken?
So, I mean, let's be clear, that patient that you're referring to actually did get care in the province of Ontario. In terms of the medication shortages, I've been working with Minister Duclos. He reassures me that the federal government is finally able to secure some additional pain medication. So some of these pieces we've been working on for weeks and months to make sure that people are protected. I would add one very important factor, and that is we need to make sure that primary care practitioners are seeing their patients before they have to go to an emergency department or a hospital. We have a robust system when all of the players are working together, and we need all of those parts to be basically operating at 100%. I wanted, and I asked the federal government to act quicker on the children's pain medication in particular. To have it end up being blocked from coming into Ontario simply because Canada, simply because there was not French on the packaging. When we are seeing shortages, I think we have to make some decisions and act faster. We're now seeing that action from the federal government, so I'm pleased on that piece. We have expanded pediatric ICU beds and capacity in the province of Ontario. That action has occurred. We continue to see primary care physicians see their patients more in person. That needs to continue. But all of these pieces together is what makes our healthcare system work in partnership, and is important that all of those pieces are operating.
I had another question about the change to payment for doctors for virtual visits. There may be some doctors after these changes that have come into effect who are fearful that they may be turning away patients based on this virtual visit model, and those patients could in turn end up flooding emergency rooms. What do you say to that?
So what I say to that is that during the COVID pandemic, we rightfully made some changes that ensured people who needed access to their family doc, their physician, had that remotely. We need to get patients in front of their physicians more regularly. The changes that are happening with the Physician Services Agreement essentially involve having a physician see their rostered patient once every 24 months. We need family physicians to be seeing patients in person. When that parent is concerned, when that caregiver has questions, the first place they need to be able to go and have access to is their primary care physician. And that's why, through an agreement that was ratified and voted on with the Ontario Medical Association, we have come to an understanding and appreciation that patients need to have access to their family physicians' in-person visits.
All right, and this will be our last reporter.
Thanks, Hannah. Hi, Minister. I'm just trying to get a sense of how much worse is this early wave of flu and RSV and whatever COVID there is. How much worse is it than what you planned for? Because it seems like it's swamped the system maybe earlier in the season than you had the system had expected.
So the influenza in particular has certainly started sooner, perhaps because of the weather. And the RSV has certainly been more serious than previous. In terms of how did we predict it, we prepared for it. I don't think in a healthcare system you can ever predict 100% what is going to happen in terms of numbers, but we have prepared for what we expected to be a more intense prevalence fall and winter season.
All right, and I've heard the medical officer for York Region told us earlier this week that flu and I'm not sure if he included RSV in this, but respiratory illnesses generally have, like, once they hit, they have a 4-week ramp up. So do you expect that to be the case this year, or do you see a more unlimited potential before this plateaus? Or do you still think that in terms of system planning, what do you expect on that front?
So at the risk of making predictions from the podium, I would say that what we are seeing is a slowing down of the increase. I'm not going to presuppose that means we are coming to a plateau, but we are seeing a slowing down of the percentage increase, which is a good sign.